welcome. This is Beyond the Headlines, and I'm Jane Goldless. In this edition, adopting tech innovations in hospital management systems. We travel to Mwanza to see how the district hospital is faring.
It's become a challenge for us locals to receive assistance at our hospital. We all scramble for help due to our neighbors from Mozambique who also come here for medication.
And in the arts, an Afro jazz artist from Mwanza who's building his music career around the Sena traditional dance known as Ute or Uche.
I try to do a music which tries to bring the traditional elements of the Sena music to the limelight so that people should also know that the Sena or the traditional elements of music in our country can be put in a perspective.
Glad you could join us, and once again, welcome to Beyond the Headlines. Technological innovations play a vital role in transforming and improving people's lives. In the realm of public health, technology plays a vital role in relation to gathering and analyzing of information by professionals for them to provide improved care to communities. However, for many developing countries like Malawi, adopting simple innovations like hospital management systems has been a challenging factor due to a number of factors, including financial constraints. But that narrative is about to change now, that some of the hospitals in the country, especially referral hospitals, have started adopting such tech innovations, as Bernard Kankono found out at Mwanza District Hospital.
Nested along the border with Mozambique, in Malawi's southern region lies the busy district of Mwanza. With a population of over 138,000, the district serves as a gateway to other countries, attracting thousands of travelers each passing day. However, this influx of foreigners in the district has brought with it diverse challenges. For years, locals like Roda Senzani of Chikolosa village in the area of traditional authority Kanduku have relied upon Mwanza District Hospital for their healthcare needs. However, this is becoming a challenge as the district continues to experience a huge surge in foreign patients seeking medical services at the very same district hospital. This scenario has put pressure on the hospital's resources, resulting in shortage of medical supplies.
It's become a challenge for us locals to receive assistance at our hospital. We all scramble for help due to our neighbors from Mozambique who also come here for medication. Some of these foreigners even use their money to bribe medical personnel so that they should be attended on time at the expense of us, the locals.
Rhoda's experience and sentiments as regards Mwanza District Hospital is shared by many in the district. However, the narrative is about to change following the installation of the hospital's integrated management information system. This system, which has been integrated in collaboration with the National Registration Bureau, has been designed to detect and identify foreigners seeking medical services at the expense of indigenous people. According to the Director of Health and Social Services at Mwanza District Office, Dr. Misha Stande, the benefits of the system are beyond curbing the influx of foreign patients. On the other hand, Dr. Stande says the information management system will also play a vital role in reducing drug theft cases as well as quickening the process of examining the patients.
So the expectations of this project is that it will help us address the long patient waiting time, because we know that patients will not go back and forth and for example, the previous system, patients had to go see a clinician, get medications at the pharmacy, but if the medication is not available at the pharmacy, they'll be sent back by the pharmacy, and then they'll have to be prescribed another type of medication. With this system, the doctor will know before prescribing that these are the available drugs. on each particular day and at each particular time, because the system is automatically updating the available medications, and the patient will surely be going to the pharmacy to get medications that are available. It's also going to assist us in addressing some issues that happen to do with pilferage of supplies. So I won't necessarily call it stealing, but sometimes I feel like I need something at the hospital, and just because I have the opportunity to access, I can easily get that supply, whether it's a medication, and then use it or get it for my relative. This new system is going to ensure that only patients that are being seen by our doctors and prescribed are the ones that are getting these medications, because everything will be accounted for. It's also going to assist us in finance management, because later on we're going to introduce paying services, whereby these services are optional for those that are willing to pay, and this system is going to bring in a component of transparency and accountability because we will know how many patients came in as paying patients and how much money we should be expecting to have at the end of the day, and this will help us rectifying some of the small issues that need finances in support of already existing support from government. And lastly, it's also going to help us in performance management of our health workers, because this system is going to show us at what particular time a certain doctor started seeing patients, at what particular point he knocked off, or for how long did he take for them to assist the patient. So we continuously get reports from this system that will show how we are performing.
The system, which runs through the local area network, currently has been connected to the hospital's focal points like the OPD, laboratory, pharmacy and under 5 clinic. According to Mwanza District Council Senior System Analyst Faustino Sibale, it took a period of less than a year for the district's ICT team to develop the system. Sibale further says the system has been designed to ensure that it protects patients' data from being accessed by unauthorized users.
What we are doing here is to ensure that patient records are kept safe with the hospital, as well as the patient history is also retracted or retrieved without having some problems. We're also enhancing our reporting part, that when reports are required, the system can auto-generate the reports. So it will be easier for even our friends in the HMIS who are also doing the report part. So the system is effective to the extent that it can reach out to many departments. The system is secured because for one to log in, you have to use a password. There's a username and password, the credentials, as well as we have encrypted most of the security parts, as well as the system has got roles. Yeah, for one who is on the registration won't be able to access some other information. So we've given roles, specific roles for each user. So we are so confident about security. We've encrypted our passwords, as well as the whole system is encrypted.
It is evident that the Integrated Management Information System has revolutionized the operations of Mwanza District Hospital. With advanced technology, the hospital can now focus on providing quality and timely healthcare to its local residents while ensuring a fair and efficient allocation of resources.